So I think on that note, that's a really nice introduction, Chris. Just to introduce you to students, this is Chris Nicholson from the University of Essex, and Heather is also from University of Essex in the recruitment department. And you're going to be here talking to us about psychosocial sciences. And someone's got a baby on the line.
That's all right. Nice.
And what, as you've said, there's a number of different areas within that which students, which will, I'm sure, be interested in. So I will let you kick off. Students who've just joined us, you are free to, if you want to unmute to ask questions, you are welcome to. If you want to put your cameras on, you are also welcome to. Alternatively, I know lots of students prefer just asking questions in the chat. So if you want to pop in the chat function and have any questions at any point, then I'm sure Chris and Heather will endeavour to answer them. So I'm going to hand over to you.
Great. Hello, everyone. So my name is Chris Nicholson. I'm the head of the department for Psychosocial and Psychoanalytic Studies. So we're not really an ordinary department in the sense, you know, we're not history or we're not law or government. You know, Psychosocial and Psychoanalytic Studies is a unique department, especially at undergraduate level. We just don't really have many I'm going to spotlight myself for the time being while I'm speaking to you. Let's do that. We don't really have many, you know, in this country, we don't really have many other courses that teach psychosocial and psychoanalytic studies at undergraduate level. You won't really get an opportunity to think about ideas from Freud or Jung or contemporary psychoanalysts that are being used in practice in psychotherapy day to day, in psychoanalysis day to day with clients, in some of the better known psychiatric centres in the country, and in research, because most of this happens at postgraduate level when you do an MA. But we think these are so important, these ideas, that we want to share them with undergraduates, younger people. And it's really important, actually, that we get younger people coming into the field with a much more personal and in-depth knowledge of human relationships, human emotion, the relationship between neurology and psychology, the mind and the brain, and how these things relate to direct practice with other people. It's never been more important as we emerge from the pandemic. So that's just to let you know that we're an unusual department, and if you come to us, you get something rather unique, rather special, and our own students attest to that. So I'm going to share my screen with you, and I'm going to make a little presentation. But I really think if you do want to ask a question, feel free to interrupt. I don't mind. It won't put me off. It's absolutely fine. Sometimes when you've got a question, you want to ask it in the moment, don't you, when it's relevant? So feel free to do that. Just let me know who you are and ask away, and that'll be fine. So there's a nice little picture there of Essex University. Let me just see. I'm trying to see exactly how I'm going to move the. Oh, there we go. Good. Great. So welcome to our department, Psychosocial and Psychoanalytic Studies at the University of Essex. I think it's really important these days, I think I've always thought it, that universities are very welcoming places and departments are a bit like a small community or a very large family. And you feel connected with us. You feel as though you have a place. It's a social relationship. It's not just about coming to study and you just study and then you go back. You actually feel a part of something, and that's really important. So in our department, we consider ourselves to be an enabling academic environment. Enabling, the reason I say enabling is we want to enable you to do very well on your degree. We want to enable you to have fun, to have a really good social experience of being at the university. And we want to have fairly close relationships with you. You know, as academics in the department, we don't want to be kind of figures that you don't feel that you can come to for whatever academic support or even emotional support where you need it. And you'll have a personal tutor in the department who would be someone that would be there to guide you through the journey of university life. So that's really important. Another thing about this notion of an academic environment is we're all learning. You know, academic tutors are also learning, and a lot of what teachers learn, by the way, they learn through teaching, because students ask such interesting questions and it really stimulates the mind and gets you going, and new ideas emerge through that. So everybody's learning together. It's not as though we have something to offer you, but you don't have anything to offer us. Of course you do. You've got a rich experience from your lives already that you bring to the department. And this is an important part of creating a community together. The department's been around for quite a few years, since the 1990s. I wasn't there then, thankfully. I'm not old enough. I arrived in 2010 myself. But we were there really as we were then called the Centre for Psychoanalytic Studies. We've grown a lot since then. And we specialised in psychoanalysis and Jungian and post-Jungian studies. So Jung, you know, is a counterpart to Freud. He was Freud's colleague. Eventually they fell out and had different ideas. But both of them were pioneering psychoanalysts who really changed the way in which we think about what a human being is. And they were the root of what we did originally. We've expanded an immense amount since then. So, you know, we're perhaps the longest running internationally known department teaching and researching in these ideas around psychotherapy, psychoanalysis, and psychosocial ideas. In other words, the way that our psychology affects society, the society around us. And we bring lots of ideas together. You know, in many places you can only study Freud or Jung, or you can only study one or other approach. But in our department, we've got a blend of approaches that includes, in fact, even now, applying psychoanalytic ideas to childhood studies, which is I think it's our largest growing undergraduate degree, childhood studies. Very, very popular indeed, because the way that we teach it is pretty unique. And I'll come on to that. So some of the courses that we're running now, we have an international course in refugee care. That's at generally that's at postgraduate level, but there's a module you can take on if you want to understand more about refugees at undergraduate level. We teach a course which is just under degree level for people that work locally. They work in schools, in children's homes, in psychiatric centres. They work in homes where women are fleeing from domestic violence. They work in addictions or eating disorders clinics, really quite hard, tough frontline services. And they do this course, Therapeutic Communication and Therapeutic Organizations. They really learn about how you apply psychoanalytic, psychosocial ideas into the frontline work with really, really vulnerable clients in complex organizations. And that's important. You can study at postgraduate level about management, how you manage organizations and how complicated that is and how difficult that is, and ways to manage those situations and develop your staff. And that's management and organization dynamics. We have a postgraduate course in psychodynamic counseling. So those of you that want to go into a clinical route and become therapists, you can do that with us. It's an accredited course. And we have an undergraduate degree, which is fairly new, in childhood studies. This year, come October, we're launching the MA in childhood studies. So you can actually come in, start at undergraduate level and go right through, which is great. And all of these degrees are at the intersection between psychodynamic, psychosocial ideas and everyday life and culture. They bring those things together. Yeah, psychoanalysis is one of those things that it's not just an academic subject. It directly applies to us. So if you're coming to our department, you will learn a heck of a lot about the subjects and about your chosen career and how you can apply these ideas to your career. But you're also going to learn a lot about yourself. It's a very personal, developmental kind of learning. and we do it in a very personal and sort of friendly way. So we're definitely one of the largest departments in the UK specialising in this area. And as I've said, our degrees go right from even under the degree level, foundation degrees, right up to MAs. And we have a very large number of research students doing PhDs with us from around the world. We're a highly international department. People come from all over because we do something a bit different. We do think of ourselves as educating the next generation of mental health workers, people that want to work in education and social care, maybe as therapists, but not just as therapists, but just want to work in those fields. And I think that's really important at the moment, because a lot of those services, and you're seeing it on the news, they're not functioning that well, actually. And the workers in those services, some of them are not therapists, but they're working in therapeutic services, have quite a limited understanding of the complexity of human nature and the kind of problems that people have, particularly in mental health areas. There can be a very negative view about mental health and mental health practice. And we have a very humanitarian take on how you deal with individuals. It's quite democratic and it's quite open. It doesn't medicalize people and just think that they need to take a lot of medication. That's a very opposite sort of view. We're much more into human treatment for human problems. We also want our students to develop critical skills and research skills, and this is because it's not just about giving back to society at a general level through the work that you might do, but also thinking about how we can contribute to ideas, changing the way that people think in society as well, and bringing about change. And of course, when you're young, you're at college. I remember when I was at college, I went to college before I went to university. And you're just beginning. You're thinking, well, what can I possibly do to change the world? But in fact, you can make a significant contribution in different areas, particularly in your own field where you choose to go. And our graduating students write back to us regularly with stories of things that they're doing, and it's just quite remarkable. I'll just give you one instance while I'm thinking of it. One of our students who studied Psychodynamic Practice, which is people that want to work, they don't necessarily want to become therapists, but they want to work in therapeutic organizations. This student's gone off to America, and they are working in a hospital with children, and they support children therapeutically. So the children are physically ill, but they need emotional support. This young person has been seen to have brilliant skills in this area because they really seem to have a sensitivity and a knowledge of the development that the children are going through and how the trauma of their illness affects them. And that's a remarkable contribution, and the students are just so excited about doing it. So many things that you can do when you do a degree with us. You will pick up something rather special. The way in which we teach is a bit different. There's a balance between academic and practice learning on a number of our courses. Not all of them, but most of them have this balance. And we use experiential learning. So you're not just listening to people lecturing. You might be doing things. You might be making an observation in a children's home or in a hospital, for example, of a child, and then bringing that observation into the seminar to talk about. You might be engaged in a project of some kind. You might be engaged in a reflective group where you're thinking about the learning that you've been doing on the course and how it's changing you and how you're seeing the world differently, and you're thinking about those things. So there's a different balance really in the way that we teach, with more things that you can actually do rather than just being in seminar rooms. There's a balance also between academic and clinical staff. So you will be taught by people who are practitioners who really understand from the inside issues around clinical practice, psychotherapy, psychoanalysis, psychology. And my background, I didn't say at the beginning, perhaps I should have, I worked with and still do in some ways with troubled adolescents in therapeutic communities. And I did that for many years. I love that work. And the only reason I'm here teaching at the university is because I can teach people about that work, And I would bring my experience of the direct work into seminars and into teaching, because I think that's what makes the teaching alive, you see. So you're taught by known experts. We've got some really international stars in our department who teach around the world, in their subject, and you get to benefit. So in these three ways, you get to benefit quite a bit. As you go out into the world and you go out into different areas of work, you're going to discover that all organizations have a kind of primary task, and the primary task is the thing they should be doing. They don't always do it. In our department, what I'm going to read to you now is a primary task, and this is what we do. We do this. The role of our department is to study the role of the unconscious mind in mental health, culture, and society, and to further the understanding of the psychosocial factors which influence our lives. We do that using psychodynamic approaches, really. But that is what we do. That is our task, and we would invite you into joining us in that task, really. We do want to have an impact on society. We do want to change the way that people think, and you can't just change people's minds. You have to change their hearts sometimes, and I think we're quite good at doing that. It might be worth noting a distinction between some of the different topics, because we get mistaken for psychology sometimes, and we're not psychology. Psychology is a bit different. Psychology is the study of the mind. It's a scientific study of the mind and behavior of human beings and of animals, actually, and it focuses on what is observable and measurable. Yeah, observable and measurable. To me, it has a degree of limitation, I have to say. It doesn't have a complete model of human life. Psychoanalysis is a little bit different. It's a study of the unconscious mind through two particular areas. One was a form of clinical practice that Freud invented, along with some others that joined him, which is psychoanalysis. So that's a clinical practice, a way of working directly with patients. Talking therapies are taken up by everyone. Even CBT traces its roots back to psychoanalysis. Really, psychoanalysis is the beginning of talking therapies. So that's a practice, and it's being used day to day all over the world. So that's one area of study, and you can study that practice. In a way, Freud's clinic was a laboratory, and he was engaged in a kind of scientific study, but in a different kind of laboratory to the normal laboratory, which is to do often with physical things, matter, and materials. With Freud, it was studying the mind in this set circumstance of a clinic. The other area, though, is a developing body of knowledge that concerns unconscious and emotional and mental processes within and between people. It includes groups, and the influence that these have upon our behavior, our development, our well-being, and of course our society and our culture. So psychoanalysis is broader, and it's these two things: a clinical element, and then how we use the ideas, the concepts like transference, projection, all these concepts that psychotherapists use. How can we apply those more widely, say, to literature or to politics or religion, those kinds of areas, refugees, Sociology is normally about social forces and facts that act upon us and shape society. And in our department, in the Department of Psychosocial and Psychoanalytic Studies, we do use some sociology. And in fact, some of our academics are also sociologists. We think linking society and the mind is very important. And that psychosocial studies, because we do teach psychosocial studies, is this combination of psychology and sociology, the individual and society coming together. Yeah, and we utilize psychoanalytic concepts to create that bridge, really, and that's what we do. This is some of our academics, the people that work in the department that are here. It's a range of people. They come from different countries. There are people that are from South Africa, from the USA, in this country, from Scotland and other places like that. Quite broad from Brazil. People come from different places, and they have different attitudes and they have different interests, and they're all very busy. They all do a lot of work, and here are some of the books that colleagues have written. you know, in so many different subjects, there are sort of very critical subjects. There are subjects about philosophy of psychoanalysis. And there are subjects about childhood, about issues to do with shame in literature, issues to do with trauma in adolescence and childhood. A broad range of different areas that are academic staff write about and think about, and they bring these ideas from their studies into teaching you. So I'm just going to make some contact now with the main courses that you can study at undergraduate level. The first one is BA Psychodynamic Practice, and that is a really good course. It's sort of alternative to psychology in a way. It's a course where you're going to study what it's really like to work in therapeutically caring and complex professional settings. And I gave an example of one of our students that was working in the USA. On that course, you'll study the theory of therapeutic work and psychodynamic work, but also the practice, how you actually do it, what it feels like to be engaged with people that have trauma or adversity in their life or mental health difficulties. You learn a lot about mental health and the different diagnoses and issues that people bring, but you really do learn about how to do that work, you know, what it's like to do it. You have a placement in every single year. So you're not just studying in the university, you're out in a placement. We've facilitated placements this year despite the pandemic. We are very creative. We find ways to push through these apparent problems. And that's been working well for students. So when you get to the end of your degree, quite unlike, I must say, a student that might study psychology, you will not just end with a lot of intellectual knowing, you know, that you would have in another degree. You're also going to have a lot of practice experience because you've been applying your academic learning directly into practice, into a setting that you want to work in. And that's really important. So that's BA Psychodynamic Practice. There's a degree which doesn't have a placement called Psychosocial and Psychoanalytic Studies. And the reason I put up pictures of psychoanalysts and Jungians and other people in this image, these are different writers and psychotherapists who work directly in Freudian modern object relations and Jungian fields. And these terms don't really matter because you'll learn all about these when you're on the degree. But in a way, this is a more intellectual study. You might be looking at literature, you might be looking at childhood, you might be looking at different psychodynamic forms of practice, you know, different models about how we work directly in the clinic with people. So it's more academic, it's applied very broadly. You think about social issues, maybe religion and politics, and all these different areas will come into the study. But you will also learn about psychoanalytic practice in theory. Now, how does it work in theory? What are the different ideas? How do you work differently, for example, with adults and children? You'll look at all of those areas. And you study reflective practice because the course will change the way that you think, and it's important to kind of think about how that's affecting you and what you're learning from it. But it's a more academic study. To that extent, it doesn't include a placement. Finally, our newest degree, BA Childhood Studies. So this is a real innovation. You can study childhood studies and all the different topics that come along with that, the different models of child development. You can study observation and reflective practice here. You might study the psychoanalysis of the child. You'll study things like ADHD, trauma, autism, and you know, these diagnoses. Are they simply diagnoses, or are there social pressures that push people into these particular problems? There's a whole range of areas you'll study about childhood, and you learn a heck of a lot about childhood, not just in the UK, but globally. But you'll also be doing a placement every single year while you're on this course. And that is a remarkable element. And most childhood studies don't include a psychoanalytic way of thinking. The benefit there is that, you know, children are not great at conveying to you what's going on for them. You have to be really good at observing them, picking up on the unconscious communications that come through their behavior, through the sort of symbolism of the language and their play. and really think about the child in a network, a social network. And we help you to do all of those things. It's a very innovative degree. It's very popular. I've indicated a bit some of the things you'll study, but I've just put up a few of the different ideas. So broadly, psychoanalytic and psychosocial approaches. And underneath that, there are things like perspectives in child development, a module called trauma and recovery, which is a psychodynamic approach. I teach that module. I really like the history of trauma, what trauma is very important at the moment. There's a module called understanding individuals, groups and organizations, and through that module, everybody does this module. We help you to learn the basic psychodynamic concepts that we all use in all of these degrees. Module called Freud, Mind, Culture and Society. There's childhood literature and psychoanalysis, current debates in depth psychology. You've heard about psychology, and then depth is getting to the unconscious, so what it is to be a human at a deeper level in depth psychology. And there are all kinds of debates there that we think about. Observation and reflective practice. As I said before, observation is really important because there's a real skill in picking up the underlying kind of issues that you see around you in individuals and in groups. And we teach observation, so you become a very, very good observer of other people. And if you're a people watcher, as I'm sure some of you are, that'll help you immensely. But the reflective part of that is you also need to turn the observing eye upon yourself. Because it's you who will be doing the work in whatever career you go into. And it's really important that you're self-aware. And that's one of the special elements of our department, that you do learn about observation, but you learn to reflect upon yourself, who you are, what your strengths are, maybe what your weaknesses are, and how you can get the best out of those and how you can develop those into strengths. And that is really important. Employers really want you to be self-aware. They don't want you to come in with lots of intellectual knowledge and you can't do anything because you don't get on with people or you're not self-aware. So that's an important module. The psychoanalysis of the child, you'll get to study counselling skills, so you learn how to use some of these skills in practice. And of course, every student gets to do a final year dissertation. That's where you take the basic ideas from the course that you've studied and you apply them now to a subject that you're interested in. So something that you particularly enjoy yourself. That's a really exciting part of the course, and you work directly with a supervisor to do that. So you have a one-to-one relationship with a supervisor who knows about your topic, and they guide you through that final year toward submitting your dissertation. Often your dissertation will be something you end up coming back to later on. Maybe you'll do an MA or something like that. It's really, really interesting how that stays with you, that piece of work. Just so that you're aware, of the efficacy, the way in which these degrees can really support your future career. And I don't know what you want to do. I hope maybe in a few minutes you'll tell me a bit about what you'd want to do in your future career. But you could do all of the things that I've listed here: family support worker, a learning support worker in a school, a primary or secondary teacher. Great to have the kind of skills that I'm talking about in teaching. Special needs teachers, a lecturer or researcher like myself. Lots of students that study psychoanalysis going into research and teaching. Social work, psychotherapist, psychiatric nurse, areas of management, consultation, because we teach these things at MA level as well. You become a mental health worker, work with substance misuse, community development worker, a counsellor, that would be a psychodynamic counsellor, an educational psychologist. You could work in human resources. You could work in marketing and advertising because you understand human psychology, what Freud calls the id. That bit which is rapaciously seeking, that's really what when you're advertising, you're trying to appeal to those needs that people have. And Freud's nephew actually was one of the people that really used psychoanalysis to apply to marketing and advertising. There's a whole body of material that emerged from that relationship with his uncle. So there's a heck of a lot, and that's not an exhaustive list. There are many other things you can do applying these degrees to future work. University of Essex gained the University of the Year Award 2018. We're constantly going for different awards and pushing ourselves harder at different things. We do a lot of that sort of thing. We've got a gold in the teaching excellence framework, so we're pretty solid in terms of teaching. You don't get better sort of level of teaching. For our department, we've done particularly well. We've been in the top 15 in the UK for 7 years in a row for student satisfaction, and our students are pretty satisfied. I ought to say to you that we've, even during the pandemic, when we've been working online, we've been doing a heck of a lot of extra stuff with our students. We do virtual cups of tea. We meet them for different activities. We have a kind of several lecture clubs. We have a student society, a psychoanalysis society. They do loads of events that our students go to. And then we've been running something called the PA 123 Club, where we get together and we look at somebody does a lecture, might be on a particular theme, like art therapy, for example. I did something on Peter Pan and Neverland, about childhood, really. And different topics, and students come along at all levels, and we just discuss those, we talk about those and that sort of thing. And there's lots of events going on. Nothing really needs to stop you. You assume that you can't do things, but there are all kinds of things you can do. I think we're one of the only departments to run an online graduation, because a lot of graduation ceremonies have been cancelled. So we'll always find a way to do things, and there's a real community and lots of things going on. We send out a newsletter to our students every week with events that are taking place that they could sign up for, and not just in our department, but around the university and around the country as well. And you can be a part of sort of social events. Now we'll be coming out of lockdown. We do lots of social events. We go and have meals together and eat and talk about stuff, and there's quite a lot going on. We have a Freud Memorial lecture every year. That's a big deal. We run that. That's in one of the events that we do, and we also now run an annual Jung lecture, and you can come along to those. They don't cost you anything. It's completely free. So there are lots of things that you can attend and be a part of. We have a number of centres. This one, CTAR, is a Centre for Trauma, Asylum and Refugees. It's run by an internationally well-known professor in our department, and that's one of our centres. We have a centre for myth studies. If you're interested in mythology and those kind of ideas, we have a centre for that within our department. And we have a new centre, actually, childhood studies. I don't even have a picture of it because it's just brand new, but it's just started in the last few months. And we're looking at other centres and programmes that are going to be coming up. So we've got new programmes starting. MA in Gender and Sexualities is going to be starting in about a year's time. And there are other degrees. I won't talk about everything. One of our ex-students, Carolyn, says, if you're coming to us, this is an ex-student, so she's completed her degree. She said, immerse yourself in the learning, become enlightened through the text as you're challenged to look at yourself and those around you in a different way. The world will never appear quite the same again, which I quite like. It's quite nice. I quite like that. Carolyn was a great student, great enthusiast as well. I think that's enough of presentation. I might have a couple of other slides, but I don't want to present them. So what I need to do is to find a way to exit the presentation. I'm not quite sure how to do that. Stop sharing. There it is. Great. I discovered it. Okay. So, there are more things I can say, and I think I've safely left us about 12 minutes. And I wanted to see if you students have some comments and thoughts. I'm gonna exit the spotlight too, and I just want to see, what do you want to ask? What do you want to know? If you want to turn on your camera, I think that's nice. I can see you and you can see me. I feel like we're having a proper interaction. Don't worry if you don't, but I just say that if you come and study with us, you're studying really human kind of interactive things. And so it is quite important in a way that you get used to the fact that it's a very intimate kind of study. You are going to be face to face. You are dealing with face to face kind of issues. But I can see there are questions and things coming in. If you want to ask something directly, I say be bold and be brave and ask it directly. You can ask your own question using your own voice. I'd love to hear your voices too. Let's see what we've got. So for the questions, are you somebody going to read them out? Does a student want to ask their question directly? How are we going to do that?
I'm happy to read them out. So.
I have also posted a link to all of the courses that Chris has mentioned. So if you do want to take a look, and if there's anything on there that you also see that you want to ask about, then feel free to do that as well.
Brilliant.
I got a question here from Fabia. So I think this is probably one that lots of students are wondering, because I imagine students generally who in this are thinking about applying for a psychology degree, and have now maybe had their world slightly opened by the thought of what you've suggested. So could you maybe just talk us through? So I just personally, I did a psychosocial sciences degree many years ago now, but mine was a BSc, and then it became a psychology department. So because Essex also has a very good psychology department as well as your own, correct?
Yes.
Why would students pick? What would be the reasons for students to pick the different potential courses?
Yeah. Okay. Well, I mean, psychology is good at Essex. I mean, there's a lot that they do here. There's a wide variety of courses. We collaborate with them in some ways, and it may be that eventually we'll end up with a joint honours course between our department and psychology. One of the things that psychology don't do is much to do with clinical work. So you are studying all kinds of elements from quite an academic point of view, but you're not really involving yourself in practice. So you're not really going to learn what it's like to actually do the work directly. And for me, that's a problem. And I don't say that as a sort of critique of our psychology department. I say that as a critique of the way the world is working at the moment, because it seems to me many people go into direct services with children, with adults who have really severe problems, and they can do that after a degree without really actually having ever been in a room with people that have those kind of problems. And even some of the readings they study are not clinical readings. They're not case examples in an in-depth fashion about what it's like for someone to do some work. What happened during that piece of work? What were the problems? What do you do if somebody you're working with doesn't come to the sessions? What do you do if they come and say that you're rubbish and you've got nothing to offer me, you're a bad therapist or whatever? How do you manage that? Well, Freud has a particular way of thinking about that. There are particular ideas that he developed about what's going on in the psychology of the person that they might do that. And I think it's really important to have a great understanding about that, and also the effect it has upon you. Why do you become a bit resistant to your clients? Why is it there are some people you simply feel that you can't work with? And you need to understand yourself to be able to do that. So if you want to come to us, I think it's going to be really about direct work, the idea that you might want to learn at a more deeper sort of human level. You do need to know the theory, you do need to know the concepts, and we've got a lot, we'll be teaching you that for sure. But to add to that, you need to know something about what it feels like in practice to do that work. In other words, to be properly prepared to go into that field. You may want to go and do an MA. That's always a possibility as well. We can support you there, but really to get a sense of what the work's like, what organizational dynamics are like. You're going to be working in an organization, so I think that's what's really important. If you're not really interested in practice at all, if you're not really interested in some of the more kind of philosophical ideas about mental life, about human beings, and notions around sort of the unconscious, what is affecting our behavior and our moods and our conduct and our social organizations at an unconscious level, then go to psychology, because they won't really be teaching much about the unconscious. They don't, apart from, I think they've got a doctorate in clinical psychology, which our department teaches on, because we offer teaching on that with the psychodynamic element. I think under that, they're not really engaged in the unconscious. But now neurology has shown us that the unconscious is an absolutely, it's a fact. It just exists. There it is, and it is affecting us in so many different ways. I think it's really important to get to grips with that element and start thinking about how that's going to have a bearing on your own life and your own work in the field. Is that okay? It's quite a long answer, really, but I hope that's okay.
Yeah, thank you very much.
I'm an enthusiast. You'll see that. I mean, I really do believe this stuff. because I've used it in practice working with traumatized kids in a very complicated, large therapeutic community with about 20 or so children. It's quite big now for a children's organisation, and about 40 staff. And I can see how the unconscious processes were getting in the way of the work we needed to do. And I found ways to get around that. And when I can talk about that, I do talk about that in teaching. But that's why I believe what I'm saying here. Maybe another question.
Yeah. Does anybody else have any questions, student-wise? Feel free to use your voices or your keyboards. I've got a backup one if no one else has any. Okay, I'm gonna go for my backup one. So again, this may be like I might be being a bit ignorant about your course here, but I'll ask the question anyway. But how does this run alongside something like BPS accreditation? Should that be something students are looking for on courses in terms of their future careers, or does it not matter, or are there advantages?
Well, I mean, yes, you can if you do a psychology course, you can get the accreditations that you need for if you want to become a psychologist. But if you don't want to become a psychologist, you don't need that accreditation. I mean, there is one way you can do it. You can do one of our degrees, and then you can go and do a psychology MA and get the accreditation there. And that is a route, that's a possible route. But we've got lots of students working in the field who don't have that accreditation, but they're still working because this is one of the fields where there is the most need. It's a bit like at the moment, hairdressers are rather full up because everybody needs a haircut. And I'm afraid mental health, those kinds of issues are, they're everywhere. And our students are not finding it difficult to be in different kinds of career trajectories because they don't have psychology credits. That's not really going to hold you back. If you want to become a psychologist, a clinical psychologist or something like that, you need those. But if you don't, you're going to need something else. We run a psychodynamic counselling MA that's accredited, fully accredited. You can take that course and become a psychodynamic counsellor. It's a 2-year course. That works pretty well. And you can also go on and do Jungian studies in our department if you wanted to go into that area of clinical work. You can study refugees and go and work for NGOs around the world. You don't need any credits or accreditation to do that. You don't need these credits if you want to go and work in education, in the field of education. If you want to go on and do a postgraduate course in social work, you don't need those credits. So, there's a heck of a lot out there. More than there is that needs these credits. Many things you can do. Work in therapeutic communities, you don't need those credits whatsoever. I must say a couple of our degrees do also have an accreditation through an organisation called APKIOS, and they are looking at psychodynamic practice as applied to organisations, and they accredit some of our courses as well. Psychodynamic practice gets an accreditation through APKIOS. So there are other ways to get different kinds of credits that you can benefit from. I'm wondering if any of the students here do want to say something. What are your thoughts about what I've said? What are you thinking about? What does it leave you with? Does it sound exciting? That sort of thing. It would be great to hear from you directly. It's in your power to ask any questions or make any comments. And when you go to university anyway, you are definitely going to be talking in groups. You're definitely going to be doing that a heck of a lot. And you're going to be doing it face to face. So you might as well start now. It'd be great to hear your thoughts and your ideas. If you've enjoyed what you've heard, or if you have some other question about it, maybe about a specific career you want to ask, I can help you with that. Are there any bold ones among you?
We appear to have some 14 shy students with us today.
Well, it may seem that way.
I think we're just about the sort of the time we was aiming for. So, Chris, I don't know if you had any closing comments you'd like to make.
Well, I mean, thanks for coming along. I hope you've gotten something out of this. If you want to contact me separately, maybe I can add my email address quickly into the chat so that you've got that. I'll do that now, and then you can have that if you want it. If you've got any questions or queries that you want to ask but haven't asked, then you can ask those. I'll be really happy to speak to you. I do reply if you write to me. I'm not one of those people who say write to me and you never hear. I will reply to you and help you with anything you need. I think that should do it.
Okay, thank you very much, Chris.
Nice
Thanks
to
very
see
much,
you.
Heather.
Take care, everyone.
Thank you. Bye.
Bye-bye. Bye.
Bye.